Many patients with established cardiovascular disease cannot get the medication their doctors prescribe due to stringent insurance practices. Here to discuss this and what other options might be available is Dr. Seth Baum, along with cardiovascular patient Mahendra Mahabir. Welcome, gentlemen. How are you?
Doing well, thank you.
Doing well, thank you.
Good. Well, I want to go ahead and start with Dr. Baum first. And Doctor, first, I think we always want to talk symptoms. How do people know if they're in this category and if they especially need to pay attention about the information you're about to share? What are some signals, perhaps, that your cholesterol may put you at risk for heart disease, heart attack, or even a stroke?
So I think really the signal we're talking about today requires a visit to your doctor. So you need to have a visit with your doctor, okay? And then you need to have blood work and look at your LDL cholesterol. Because what we've learned over the years, over decades in fact, is that LDL cholesterol, the bad cholesterol, causes heart attack and stroke. It actually causes it. So a high LDL cholesterol, higher risk. Low LDL cholesterol, lower risk. When we lower the LDL cholesterol, we lower the risk, and we have certain strategies to do that.
Well, I think before we dive into the strategies, we need to bring your guest in, I was going to say. And Mahendra, let's talk about what you were able to experience and how you first got diagnosed, and how has your life been impacted by cardiovascular disease?
Well, my cardiovascular disease started very young. I've had 4 heart attacks. I've been ballooned 4 times. I've had 7 stents placed, 5 arteries bypassed, and I'm a perfect candidate for the PCSK9s, which is Repatha. When it was prescribed to me, when it first came out, I was denied, and I was shocked. And it took months and months and months of fighting and back and forth from the insurance company and getting help from many different places to bring awareness to my struggles, and that's why I'm here.
And I was going to say that is why you're here today. So Dr. Baum, talk about how this really is life-changing and some of the research that you've done to show that it is a fight. Patients are having to fight for this with their insurance companies.
Well, first, the life-changing part. There was a major outcomes trial last year called the Repatha Outcomes Trial that proved that Repatha lowered the risk of heart attack, stroke, and coronary revascularization in patients with established cardiac disease, like Mahendra Mahabir. In fact, the data were so compelling that the FDA changed the prescribing information for Repatha in December of 2017. But as you point out, we can't get access. And I and a number of other people have published a number of papers proving that from a payer standpoint, it does not matter what your LDL is. It does not matter whether you've had a prior infarct. None of these things matter when it comes to gaining access. So it's really something we're struggling to figure out. The denial rates are up to 70% in commercial insurance. Tomorrow, I'm going to show that the event rate in those who are denied, when I say event rate, I mean number of heart attacks and strokes and revascularizations, is actually higher than in that group of patients who just try to get prescriptions. So in those denied, it's even higher. That means we're denying, or not we, the payers, the insurance companies are denying the high-risk patients. That's very bad.
Gentlemen, thank you so much for shedding light on this. We really do appreciate your time.